Mr. Chairman, distinguished guests, ladies and gentlemen. Let me start my presentation with my personal thanks to our distinguished guests from the United States. I visited your country in the beginning of this year, and I had a wonderful possibility to get familiar with your progress in e-health sector. Now we have again a great opportunity to discuss these common and interesting issues. Before I go into details in my presentation, I would also like to thank the organizers of this conference. It's really very important to handle these issues at an international level and in global context. Ladies and gentlemen, at first I will very briefly go through the main parts of the Finnish strategy. The first part is to take electronic healthcare record in use by 2007 in Finland. To achieve this goal, we have formed at the national level 5 different cluster projects where all main vendors have their own cluster with their customers. These clusters are under national control, and every vendor has given the commitment to use the same and common standards. For the nursing documentation, we have only one national project. The second part is to transfer and archive the digital patient information. For this purpose, we have made a decision of nationally centralized system. Our objective is to organize only one digital archive in Finland. This archive will be used by the healthcare professionals and later also by citizens themselves. We have received an allowance in the state budget to start organizing this centralized model. We believe that this solution will be widely used in Finland before 2010. Legislation is the third part of the strategy. In healthcare, it's most important that the citizens and the healthcare professionals are aware that patient documents are legally valid, also in digital form. That's why we have started to prepare the new legislation. The new Act of the main principles in handling digital customer information in social and healthcare services is under work. The official proposal to the Finnish Parliament will be given next spring. This legislation will enter into force in the beginning of 2007. Finally, I will also mention the changed management. The aging population is a huge challenge to the productivity of the healthcare system in any country. In Finland, we already have new models in laboratory and imaging functions and good examples of time-saving workflows also at clinical level. However, the investments in technology are rising, and we have not yet seen remarkable returns of these investments. It seems that change management has a very important role in achieving these goals. Ladies and gentlemen, this was a very brief introduction to the main parts of the Finnish strategy. As you all can understand, the implementation of our national strategy is a huge challenge to cooperation. In this cooperation, we need healthcare professionals, politicians, vendors, IT professionals, international connections, financing bodies, etc. We need common and deep understanding that effectively used technology is one of the two most important issues to guarantee the healthcare services also in future. Finland is a small country with only 5 million people. Rather than having small regional projects and thus building overcapacity in technology, we need a strong commitment to common objectives and total trust to each other. Indeed, we need to understand that the only way to get the benefits in technology is to move from hierarchic system to network system where the use of digital data is maximized. Currently we have a huge national project which aims to change the structures of the Finnish public service systems and also the number of numerous municipalities of Finland. I also promise that the national coordination in technology projects financing will be reorganized. I hope that we can find a financing model which is common to all financing bodies and financing resources can be used more effectively already next year. Distinguished guests, ladies and gentlemen, I have given here a brief introduction to the Finnish model in technology in healthcare sector and also description of the need in the cooperation. I will take this opportunity to underline that all participants in this conference take this cooperation at all levels very seriously. As I said earlier, Finland is a small country and we have a good basic infrastructure. I personally believe that we have a good possibility to succeed and get the technology in efficient use also in healthcare sector. I wish you all a successful conference and I am sure that this conference can promote the cooperation between different partners and also between different nations. Thank you very much. Thank you, Mr. Chairman.